It was 1 year ago today, after months of waiting and watching the spread.
Kentucky has its first confirmed case of the coronavirus.
Overnight, life dramatically changed. Cases and deaths rose.
I couldn't even leave my bed and go to the next room because it felt like I was just suffocating.
Social distancing, masking, work from home. These became the new buzzwords for a confusing time. Schools, sporting events, and life's milestones like graduation changed dramatically.
Everybody still gets to see each other and celebrate a little bit, so it's definitely different, but it's better than virtual.
The human cost, more than 4,500 lives lost, loved ones left behind, more than we could bear.
And he said, "They're getting ready to ventilate me. I just wanted to tell you I love you."
But despite the need for social distancing, Kentuckians came together like never before, with new heroes being celebrated in healthcare, education, and the service industry.
Do something for someone else that will make you feel good and help someone out in the community.
Now, a year into this pandemic in Kentucky, comes a shot of hope in the form of vaccines, returning to school, new ways of doing business, and finding ways to remember those we've lost.
We're going to end up placing an American flag on our grounds here at the Capitol for every single individual we've lost. And as we move forward, we're going to keep doing that.
LEX 18 presents a year of loss, resilience, and hope. COVID-19 in Kentucky. Good evening from our state capitol in Frankfort. I'm Nancy Cox.
And I'm Larry Smith. 2020 brought something that really none of us ever could have imagined. A once-in-a-lifetime pandemic that took Kentucky and the world by storm, changing our daily lives as we knew it. And let's be honest, it hasn't always been easy. But in our struggles and even through the hard times, we've seen our fellow Kentuckians rise to the occasion to help and inspire others.
In many ways, it's hard to believe it's been a year since Kentucky had its first case of COVID-19 confirmed.
And what a year it has been. LEX 18's Catherine Collins takes us back and shows us how it all began.
It's a phrase we've now heard over and over again.
We will get through this. We will get through this together.
It's been the governor's near daily reminder to Kentuckians since the pandemic began. He's given over 250 updates on the coronavirus in the last year. But let's start at the beginning.
This afternoon, we are announcing that Kentucky has its first confirmed case of the coronavirus.
March 6, 2020. At the time, health experts told everyone to crack down on hand washing and social distancing. But quickly, that proved not enough. By mid-March, the first Kentuckian had died because of the virus. Schools were closed, dining in was no longer an option at restaurants, and other quote-unquote non-essential businesses were shut down with no reopen date given.
What is it like to have all that uncertainty?
It's deafening. It's like a silence that you just can't cut through.
Kentucky hunkered down.
I thought maybe I better stock up on a few extra groceries because of everything shutting down.
People commiserated online and bonded over memes. They did what they could to take care of each other. By April, cases had exceeded 1,000, and the governor urged people to celebrate Easter virtually. Protesters, many frustrated over losing their jobs, began to speak out against restrictions.
We, the people, are the essentials, all of us. And it's essential for all of us to work in order to keep this country thriving.
May 11th, the first phase of reopening businesses began. COVID testing was expanding across the state. Masks became a part of everyday life. In June, frustrations over unemployment benefits boiled over. People waited in line for hours to get answers.
These two kids right here have been in this line for 10 hours with water and chips because they told us we would be seen no matter what, if we was above so-and-so line.
And by July, a spike in cases likely driven by summer travel and Independence Day celebrations hit the Commonwealth.
We need people to change their plans because it's a life and death matter for this Commonwealth.
The governor mandated masks, and come August, he recommended schools stick with virtual learning, disheartening for some parents who worried their kids would fall behind.
Me, myself, I don't have a support system. I don't have friends and family and everything that I'm surrounded by.
it's pretty much me and my daughter.
The 146th running of the Kentucky Derby was held with virtually no fans, and for the first time ever in September.
Has won the Kentucky Derby!
After a plateau, COVID cases were on the rise again. And as Thanksgiving neared, Governor Beshear announced more restrictions, closing bars and restaurants to indoor service for 3 weeks.
If this is a sacrifice that my business has to make to try to help with this, fine. I just want to know who's going to help take care of my people who are being impacted.
In December, some Kentucky hospitals were near capacity. Deaths were at an all-time high. But there was also a glimmer of hope, the arrival of the first shipment of coronavirus vaccine.
Today is the day we start winning the war against COVID.
But the losses continued. Kentucky marked 3,000 coronavirus deaths in January. And even as the Commonwealth moves forward, case numbers and the positivity rate began to decrease in February. Those losses are deeply felt.
And here we are now. Our lives would be unrecognizable to the version of ourselves from this time last year. But vaccination sites continue to pop up across Kentucky, like here at Kroger Field. And thousands more are vaccinated each week. That number is only expected to grow. Governor Beshear says we will defeat the virus this year.
Thank you, Katie. For weeks, we watched other states across the country announce their first cases of COVID-19. And on March 6th of last year, things changed here in the Bluegrass. A young woman from Cynthiana became the first confirmed COVID-19 patient in Kentucky. LEX 18's Lee Searcy spoke with that woman shortly after her diagnosis and again recently to tell us how she's doing.
Julia Donahue wasn't even 30 when she became Kentucky's first confirmed COVID patient. She was sick in early March, but couldn't shake her symptoms.
Like a headache and a cough, and I kept getting a fever.
Within a week, she went from bad to worse.
It only took maybe 4 or 5 days for me to start losing my breath, and where I couldn't breathe, I couldn't even leave my bed and go to the next room because I'd have a coughing fit. I'd be gasping for air. It felt like I was just suffocating.
The normally healthy baker ended up in UK hospital on a ventilator for 9 days. We spoke to her a few weeks after she came home.
But I had to be on a machine to breathe.
You're not even 28 years old, and you didn't fall into the high-risk category, and you came close to death.
Yeah. It's not a fun experience, and nobody's safe from the virus. You don't know how it's going to affect you.
Case in point, Donahue says the health department traced her case back to a person who tested positive for the virus but never got sick.
Somebody from the church had traveled and went to another state, and they had tested them and they ended up being positive.
Several weeks after our interview, Donahue returned to work at the bakery. She's very private. She wasn't used to the spotlight then and still isn't, which is why she preferred not to be interviewed this time. She tells me she still experiences side effects from COVID, such as frequent headaches and fatigue. She says she also gets periodic rashes like never before and gets out of breath easily. As for getting the COVID-19 vaccine, Donahue says no, believing she'll have a better chance of fighting off the virus herself than risking potential side effects from it. But a year later, Donahue still enjoys the comfort of her pets and stays busy doing what she loves, baking and decorating cakes. She knows her close call with COVID could have ended much differently.
I think it was God. I think He wanted me to live, and I think all the people that pray for me, I really appreciate those prayers.
In Cynthiana, Lee Searcy, LEX 18 News.
This field of flags is a sobering reminder of the real toll this virus has taken on the Commonwealth.
Nearly 5,000 of our fellow Kentuckians have died of the virus. Think about that. That's nearly 5,000 families left behind to try to cope. LEX 18's Michael Burke spoke to some of those people who hope you'll remember their loved ones as more than a number.
On a sun-drenched late winter day, the grounds at the state capitol have never looked better to Missy Sloan.
My daddy is one of those flags.
And as far as Missy is concerned, there was no better daddy in the world.
I could sit here all day and tell you the great things about that man. Was a great dad to me, my brother, great husband to my mother, great grandfather to his grandkids.
Ronald Greer, the Vietnam veteran who made his living as a farmer and in a factory, died from pneumonia induced by COVID-19 in late October. The family watched him take his last breath over a FaceTime call. Everyone except for Missy.
I refused to watch my father die over video.
Maybe in part because she's still kicking herself over the outcome. Missy took Dad to the hospital for issues unrelated to coronavirus weeks earlier.
What if we hadn't ever taken him in the first place? What if, when he said on Friday, just take me home? What if I had just took him home?
This reminds me.
Lisa Lockhart is a nurse at Danville's Ephraim McDowell Hospital. She spent her career making others feel better, but in the end, couldn't do the same for her father.
He didn't have to die. He didn't have to die.
Louis Baumgardner passed away on New Year's Eve, another victim of the virus, another child left with questions that won't ever be answered.
If only I had done this, if only I had done that, if only I had insisted that he move into my house.
Lisa's dad loved UK, loved his family, loved that his daughter became a nurse, just like Mom.
We had masks everywhere. There was a mask in every room in his house. We made sure that everybody knew to be careful. I lectured him like he was a little kid, and he knew, I'm doing what I'm supposed to do. I can't honestly tell you where he got it, but that's what makes COVID so scary.
This memorial is what makes COVID so real.
But Lisa and Missy are not alone. Clearly, these flags represent the thousands of Kentuckians we've lost to COVID-19 over the last 365 days. Becky Greer's father is represented here as well.
Right before they got ready to ventilate him, and he said, they're getting ready to ventilate me. I just wanted to tell you I love you. And I told him everything was going to be okay.
But it wouldn't be okay. James Gobby would pass away days later, leaving Becky and her siblings behind, including a brother, a firefighter, just like Dad was. Becky doesn't know how he contracted it, doesn't really matter, because she was now burying her father less than 2 months after losing her father-in-law.
When we were at the funeral home with his viewing, my dad was being admitted to the hospital.
Becky is referring to a viewing for Missy's dad. That's right, they're sisters-in-law who lost their fathers within 40 days of one another, and it happened just as Christmas was approaching.
I bought my mother what he would have bought her, you know, so I tried to fill that, a little bit of that void for her.
That helped fill a stocking, but how do you fill a hole that's been left in a heart? Lisa now has lost both parents in just the last 18 months.
I do take some solace in that because my father grieved terribly the loss of my mother.
And Missy is grieving just as terribly over the loss of her dad.
The one, if you needed, who was always there, that's gone.
But not forgotten. When our state's highest-ranking elected official looks out his office window, he sees this, a not-so-subtle reminder of the Kentuckians we've lost during the last 365 days.
It's amazing that something's being done to honor the fallen to COVID.
Sadly, as these blue marks indicate, the tribute is likely to keep growing as we move into year 2. Michael Burke, LEX 18 News.
He's the most recognizable face in Kentucky's fight against the pandemic.
Up next, Governor Andy Beshear talks about life over the past year and his leading role in the fight against COVID-19.
Welcome back. Just months after taking office, Governor Andy Beshear faced one of the greatest crises that this state has ever faced. His efforts to curb the spread of the virus got national attention, but at the same time, he also faced plenty of backlash for the decisions that he's made. Well, earlier today, I got a chance to speak with the governor about all that's happened over the past year and talk about his efforts to see Kentucky through this pandemic.
Well, I remember March 6th of last year so vividly. It was this beautiful day, and I'd left work a little bit early because it was so nice outside. It was Friday. I was ready to throw a little baseball with my son, and that's when we got the call, and everything has been different since that day. To have thought or comprehended a once-in-a-century pandemic, none of us knew what this last year would have been like. None of us have lived through anything like this before. And so I don't think any of us knew exactly what was going to happen, the journey that we were all going to take together. But it's one that we have taken together each and every day from March 6th when we had that first case up to today, where we've got these 3 safe, efficient, and effective vaccines that we're getting out there.
It's one thing for us to go through it as citizens. It's something else for you to go through it as the leader of the state. And so what things went through your mind in terms of understanding that every single day you had a lot of decisions to make that are going to impact a lot of people in a very unique way?
I think very early on, before we had our first case, we were getting the right type of scientific advice that said this was going to be a life and death situation every day, that the toll was going to be great. And I think I realized, I was talking to my wife one of the very first nights, that regardless of what I came into office to want to do, this would probably be the most important thing I would ever be called to do as a public servant. And so to me, doing it right from the very beginning was more important than anything else. But it's painful on all of us. That grief that maybe not all of us knew in March, just about everybody has experienced now. It's a grief of those that we've lost. It's the grief of how our lives have been turned upside down. The hits our personal finances or our emotional health may have taken, the experiences that our kids may have lost. But like you all are talking about tonight, we have seen the resiliency of people, and that's something that we've had to be in our office too, is resilient, knowing day in and day out we make the very best decisions we can, but we make them on what's best for our families and never on any other factors other than let's do right by our people, because this is the calling. This is what we have to do right, and everything else will work out later on.
Well, we have now not one, not two, but 3 different vaccines for this. Planning obviously is such a big part of this, and as you just mentioned, kind of hard to plan when you don't know what tomorrow's going to bring, but there now is a path. There is a map now. How does that change your approach in combating this pandemic now that you have the tools to do so?
Well, first, let me say it is a miracle that 1 year in, 1 year since our first case, that we not only have 1 but 3 effective vaccines, and we have 20% of our population that is 18 and over that can take the vaccine that has already been vaccinated. Just think about that. There's so much hope right now. And we've vaccinated 700,000 Kentuckians as we're talking today. We're gonna vaccinate 700,000 more just in the next month, and the pace is going to pick up from there. So there is a bright light at the end of this tunnel. We got to be careful as we get closer to it to make sure nobody's left behind, that we get the vaccine out equitably, that we continue to mask up, that we address vaccine hesitancy. But my goodness, there's more hope right now with declining cases and increasing vaccinations than at any time since March the 6th of last year.
We've discussed Andy Beshear, the governor, and Andy Beshear, the public servant. How has Andy Beshear, the person, weathered this storm and this pandemic?
Well, I think I'm going to need time to process once all this is done, too. I think like all of us, I've had good days and I've had bad days. I've had days where I pop up ready to fight, and I have days where I wonder if I'm out of gas just like everybody else. I don't think anybody comes in knowing what to say to a hurting nation and a hurting state going through something like this. What I can tell people is I've done my best every day. I look forward to the brighter tomorrow, and I hope that all of us will take the time to process as we come out of this, knowing that we'll have some scars inside and out, but also knowing that we are capable of so much more. While it's been hard, if we can defeat a 1 in every 100-year pandemic, if we can do it in a year and change, I don't think there's any challenge that we as Kentuckians can't face together.
Thank you so much, and again, have a great day.
You too.
One of the most controversial decisions the governor made was to close school buildings and have schools set up virtual classrooms. We'll look at the impact the coronavirus has had on Kentucky students.
Tonight, we're also taking time to honor those we've lost. They're more than just a number. They're Kentuckians taken too soon, whose loved ones' lives are forever changed because of their loss.
A crisis within a crisis. 2020 is set to be one of the deadliest years of the opioid crisis, with overdoses reaching an all-time high across the nation. LEX 18 Sophia Millar looks back at the impact COVID-19 had on this vulnerable community and how recovery organizations stepped up to meet a rapidly growing need.
Federal and local governments are investing millions of dollars into solving the opioid crisis. And for a while, it was working. But then COVID-19 happened.
It's been scary.
Tadra Curry is in recovery after a decade of addiction to prescription opioids.
I just celebrated 4 years on January the 12th.
She relies on routine, work, family, and friends to keep her on track, just like a lot of people in recovery. So when Kentucky went into lockdown in March in the governor's effort to contain the spread of COVID-19, there were consequences. The shutdown disrupted access to substance abuse treatment resources like Narcotics Anonymous meetings.
I had 4 friends overdose in 1 week. Like every day of the week, somebody was dying.
Curry says the people around her started relapsing. David Zubak says he saw it too.
When you're closed in a house, it's almost like a jail cell. So I'm sitting there with all this idle time in mind, and I just don't know what to do, and that's what we tend to lead to.
Curry and Zubak work in substance abuse treatment centers and regularly attend Celebrate Recovery meetings. They're watching the role the pandemic is playing in drug overdoses develop in real time. But the depth of the problem wouldn't sink in until months later. In December, the CDC issued a health advisory after new data leading up to May 2020 revealed drug overdose deaths increased by 21% in the United States. In Kentucky, the overdose death rate increased above the national average to 27%.
The numbers are scary, but there's so many people in recovery too.
Curry says harm reduction organizations stepped up in 2020. When they couldn't hold face-to-face meetings, they offered virtual ones.
It's helped, but it's a lot different. You're looking at a screen, you feel like you're talking to yourself, and when you share in a meeting, people laugh and you don't get that.
The expansion of telehealth also made treatment options more accessible. But in the early months of the pandemic, many centers temporarily closed or stopped accepting new patients. And in this community, timing can make the difference between life or death.
We need to get them in bed today because they may change their mind in 3 hours.
Curry's employer is among those responding to the growing need. Addiction Recovery Care opened multiple new addiction treatment centers in 2020. Crown Recovery Center opened mere months after the coronavirus arrived in Kentucky. Now it's on its way to becoming one of the largest and most comprehensive treatment centers in the United States. ARC repurposed the former St. Catherine College campus into a 756-bed addiction treatment center. The center's CEO, John Wilson, says he doesn't regret opening in the middle of the pandemic.
The need for drug addiction treatment exists more now than ever because of COVID. The longer that we wait, the more people die. That's just the reality.
Wilson says they've adjusted to meet safety measures while trying to retain as much of the pre-pandemic normalcy as possible.
These are not bad people. They're sick people, and they just need help.
Patients living on the campus have access to healthcare, job training, and peer support. And while many of the meetings are in person, some have staff join via Zoom.
They never did this until COVID.
And so harm reduction experts are finding ways to adapt to the limitations of the pandemic inside and outside of residential treatment centers.
We're really addressing a pandemic within a pandemic. And this is the pandemic nobody wants to talk about.
And experts do say while overdose rates have not reached pre-pandemic levels yet, they are starting to decline. And so their work continues into 2021. Sophia Millar, LEX 18 News.
One of COVID-19's greatest impacts was on Kentucky children, parents, and teachers. With schools shuttered, homework took on a whole new meaning.
Kristen Edwards takes a look back at when learning from home started and where we are now.
On March 13th, 2020, Governor Andy Beshear made this announcement.
And we have instructed our school districts to cease in-person classes for at least the next 2 weeks, starting on Monday.
As those 2 weeks turned into months, frustrations boiled over.
There's just so much at stake here. And the longer this keeps going on, it seems to be more and more of a detriment to these children.
To watch a 5-year-old stare at a computer screen with headphones on all day is depressing, to say the very least.
Other parents, principals, and teachers alike heard these concerns loud and clear, but were worried about the consequences of going back to the classroom too soon.
If we get permission to come back, and we try to come back, it's only going to be a matter of time before I run out of substitute teachers, before I run out of custodians, before I start sending kids home.
Now, my school's 70% free and reduced lunch, a large refugee population. I want to be back in school more than anyone, but I have a hard time arguing that that is the safest thing to do for my students and for my staff members.
As time went on and feelings of resentment grew stronger, some parents jumped ship from the public school system and moved their students to private schools.
It is not good for these children. I don't know what an entire generation of children looks like where their own school systems don't fight for them, don't fight for their future.
In more recent months, some school districts have slowly brought kids back with precautions in place.
I mean, it's okay, just as long as I don't get sick.
I think they've done a phenomenal job making sure that students are following the protocols and just to keep everyone safe.
And on February 22nd, Fayette County allowed kindergarten through second grade students in the building for the first time in 11 months.
I'm a little bit frightened with the dangers due to COVID and stuff like that. But I think she's very, very up to date on her protocols. We work with a mask all the time. And I'm ready for her to get back in there and get some real teaching.
But there is some apprehension about whether in-person learning will last.
I'm so terrified that we're going to get in the school, get in the routine, and they're going to shut us down again.
But as cases continue to decrease and vaccinations increase, only time will tell for when all Kentucky children, teachers, and staff are safely back in the classroom. Kristen Edwards, LEX 18 News.
No one has seen more of how this virus has taken its toll on Kentuckians than the healthcare workers in offices and hospitals. LEX 18 anchor Dia Davidson wanted to get up close and see just how the battle against COVID-19 is being waged by the doctors and nurses that often don't get much of the spotlight, yet are doing some of the hardest work to keep Kentucky healthy and safe.
How did that change your jobs? How did that change or impact you?
Well, I think from a nursing standpoint, we immediately started preparing. And so we started taking inventory of our supplies. We started practicing our donning and doffing for the isolation rooms and doing research. How can we treat these patients to the best of our ability to gain the best outcome possible?
Can you talk us through what it's like in the emergency room? Because we've seen images all around the country of the dire need for ventilators.
Yeah, it definitely put us on our toes, a heightened awareness, heightened sense of screening, being more diligent in trying to determine, is this a risk of COVID? So it was more of a deep dive into the symptom history, the contact tracing, and then try to determine what is your risk factor, for developing severe disease.
Initially there was no good test. And then when there was a test, it would take up to a week to get back. Figuring out how to categorize and separate those patients and then isolate them and then advise their family members on what to do was pretty challenging, just especially at the beginning when there was no good information.
Unfortunately, with COVID comes isolation, and a really big part of a treatment plan is, when you put somebody in isolation, sometimes their morale is not the best. So to sort of combat that, we have iPads in the unit. So we FaceTime family members and friends. If the patients, they can use that anytime that they want to, and it sort of gives them a connection to the outside world.
Dr. Harrison, though, the burnout, factor for healthcare providers.
It's tough. It's long days. It is high. The volume came down as it did across the country, but the acuity went up, meaning that we didn't see the same number of patients in a day, but those we were seeing were sicker.
What is your sense on suggestions or concerns that parents are having about children being exposed to COVID-19 and long-term effects?
I've actually been through COVID-19 personally with my daughter. She's 13 years old and she had a fairly severe case of it. She was hospitalized actually. So what I can tell other parents from a nursing standpoint and from a parental standpoint is to take the precautions. I know these children don't like masks. I know that maybe hand washing isn't at the top of their priority, but you just never know when it could be you or your child and how severe, the virus is going to affect you.
Thank you all so very, very much for sharing your insight on this in this 1 year since we first heard of COVID-19 and how it has changed the way in which we live and probably for the rest of our lives. Until next time, I'm Dia Davidson.
Welcome back. When COVID-19 began, there was a lot that we didn't know.
In the last year, health experts have been able to answer a lot of questions, but one of the biggest remaining is how we bring this all to an end. LEX18's Angie Bevan sat down with an infectious disease expert to talk about what we've learned about COVID-19 and where we need to go to defeat it.
Dr. Kathleen Winter is an infectious disease epidemiologist and a professor of epidemiology at the University of Kentucky. Most of her research is in disease prevention and immunizations.
Epidemiology generally is just studying the occurrence of disease. So what are the patterns of disease that we see in the community for any disease?
Whether it be chronic or infectious like COVID-19. And what are the causes?
Ideally, you're using all of that information to help design interventions to prevent disease.
In early 2020, Dr. Winter's focus shifted. It shifted sharply to the spread of COVID-19 in China.
And even at that time, I thought, this is coming to the U.S. I did not think it would come so quickly. I thought we might have a few handful of cases here and there associated with travelers and then some big explosion. But we certainly saw more rapid transmission than that early on.
And that's when we saw the world as we know it come to a halt. And scientists and doctors like Dr. Winter dug in, meticulously studying how COVID was spreading and understanding what they were dealing with. In addition to her teaching and research at UK, Dr. Winter has been consulting the health department since COVID arrived. Through the course of 12 months, an infectious disease and the strict measures intended to slow it became larger than life. And living in a pandemic became our way of life.
I think COVID will change everything that we do, not just in the infectious disease world, but really in most other areas of industries.
The emergence of effective vaccines has been a game changer.
I never anticipated we would have so many really good vaccines.
The downward trend in cases we're seeing in Kentucky is encouraging and a hopeful end to a pandemic that rewrote the rules. But Dr. Winter says we will always live with this virus in some capacity, just like we do the flu and other viruses and illnesses.
We will see a suppression of disease, but I don't think it's actually ever going to go away. It's very hard to eradicate a disease, and as you know, we've almost never done that throughout history.
But leaving the worst of COVID-19 in history is the way we want to go. In Lexington, Angie Bevan, LEX18 News.
He's the doctor who is in the room where it happens. Up next, we sit down with the man who's keeping a close eye on COVID-19 Kentucky and coming up with ways to help beat it.
When the pandemic began, Dr. Stephen Stack became a household name. The Lexington physician became the driving force behind Kentucky's battle against COVID-19. I sat down with Dr. Stack to talk about his approach to beating the virus and the personal toll this last year has taken on his life. 1 year ago, would you have dreamed that we'd still be in this fight to overcome the virus?
I don't think any of us dreamed that we would be here. So this has been quite the journey and quite a challenge for all of us.
Right now, the biggest concern we're hearing from the public is, of course, about the vaccine distribution. Everyone seems to keep hearing that every week. We're really going to have an influx. We're really going to have an influx. So we know that supply is an issue, but also getting it to people. Can you understand these frustrations, and what would you say to them?
Oh, sure. It's very frustrating. We've been through a once-in-a-century pandemic. People's lives have been upended, businesses disrupted, our social activities interrupted. So sure, I mean, everyone's impatient to put this behind us and get back to life as we miss it. So as of yesterday, we'd immunized just about 700,000 Kentuckians. I estimate we'll immunize another 700,000 in the month of March. That would be 1.4 million Kentuckians or more over the span of the immunization project.
What about for those folks who are still hesitant to get it? They don't trust it, or they want to give it some time. What would you say to them at this point?
I'm confident in all three of these vaccines. I would take any of the three of these, and I believe that they are incredibly protective in keeping people from severe illness. So I hope people get progressively more comfortable, but we need to meet individuals at their place of comfort. There's no one here telling you are right or wrong for your individual choice. We just want to make this available to you so you and your loved ones can have the same safety and protection everyone has the opportunity to have, and then empower you to make your own personal choice.
You brought up a good point there. We're focusing on how effective it is in keeping you from getting COVID-19. But a reminder, even if you get it, we're talking about these vaccines being able to keep people out of the hospital, off ventilators, and saving lives potentially.
So all three of these vaccines are incredibly effective preventing you from dying from COVID-19. All three of these vaccines are very, very, very effective preventing you from being in an ICU or critically ill. They're all very, very good at doing these things. And so that's one of the reasons we want to make sure they're available to everyone.
On a different note now, Dr. Stack, emotions have run high for so many people. Many have felt hopeless or even desperate in some cases. And you actually had some vandalism at your home. You were personally targeted. What about the toll this last year has taken on you professionally?
Well, you know, thank you for asking that. I think the bigger question is the toll it's taken on society at large. People are hurting, right? People have had their businesses, their lives, their children's education upended. And so, while obviously it was difficult for myself and my family personally to go through that, I'm always aware and self-aware that the people at large in Kentucky and the nation are hurting from this pandemic. And so we have to focus on all the kindness and the caring and all the good acts of human behavior that have happened, and the good so far outweighs the bad. So I guess I would reframe that and say it's a privilege to serve. I'm humbled by the opportunity, and I remain grateful for this opportunity that the governor and the people of Kentucky have afforded me.
As the world shut down, their jobs sent them into overdrive. Meet some of the frontline workers who helped make sure Kentucky families had what they needed as the pandemic made things uncertain.
Welcome back. When the world as we knew it changed 1 year ago today, many of our lives came to a halt. But for those deemed essential frontline workers, well, they got busier than ever.
LEX 18's Claire Crouch spoke to a few Kentuckians who became heroes overnight.
Whether it was delivering the PPE items you found on Amazon or dashing to the grocery store to keep your family healthy.
Would you like for us to help you out?
It's pretty hard to find someone whose life hasn't been impacted by these frontline workers.
I don't know. I never thought of myself of anything but just a UPS guy.
For UPS driver Mark Walston, he's been out on his route every day over the last year.
It's just different now because people used to come out and greet you and take the package. Now they just look at you through the window and I'll wave.
With PPE on demand and people staying at home, he says he's delivered more packages over the last 365 days than any other year during his 42-year career with UPS. And for added impact, his son is also on the front lines, delivering for UPS in Richmond.
We want above and beyond and worked some long hours, but we got it done safely and effectively. It's just humbling and gratifying to help someone.
KJ Washington has worked at Kroger for 25 years.
I run the front end, customer care, take care of the customers, do it all, really.
She says at times over the past year it's been scary, but she's also felt taken care of. Her company pouring over $1 billion into safety measures and thank you programs.
We're in here every single day sacrificing our lives. Our lives are on the line every single day.
As she's been helping customers each day over the last year, KJ has felt the true pain of the pandemic, losing 2 loved ones to the virus. But she kept showing up every day, knowing her job was vital to the survival of others.
It was stressful. Sometimes I felt like I didn't even want to come to work, to be honest. And then we have family, so to go home to your family, you have to be safe around them and everyone else also.
Neither KJ nor Mark wear scrubs for a living or perform surgery, but they are heroes in their own right. Each of them going out each day and risking their own health for the safety of their loved ones and perfect strangers around them. And now that there's hope on the horizon in the form of a vaccine, they both say they plan on getting it so they can continue to do so.
Are you excited to get the vaccine, or do you feel nervous?
Oh, I feel nervous, but I feel like I'm going to do it for my health.
I'm on the list, and when they call, I'll go get one.
For Mark Walston, he continues on his route throughout Franklin and Woodford counties, not knowing what exactly is inside each package he delivers, but knowing it's bringing the recipient some sort of satisfaction and never looking at himself as a hero.
Doctors, nurses, EMTs, those guys are the front line. We're part of it, maybe. I never thought of myself as that type. It's a good feeling knowing that I'm bringing something to you that you need.
And for KJ, she continues serving up freshness and friendliness at the Richmond Road Kroger in Lexington, putting on a smile that emanates even under a mask.
Wash your hands, wear your mask, keep your distance, stay safe.
Risking their lives day in and day out so we can take care of our own. Claire Crouch, LEX 18 News.
It's been a tough year, and there's no doubt there'll be more tough times ahead in the months to come. But things are getting better, and with several vaccines now in play, certainly there's light at the end of the tunnel.
As Governor Beshear likes to say, we will get through this, and we'll get through it together. Stay safe, everyone, and thanks for watching.
Have a great night.
We're not here simply to mark a number, but to remember these are real people. These are our people that we lost way too soon.
And it can happen to anyone. And I just wish people would realize that.
There are grandparents and parents, our spouses, our siblings, our friends and neighbors, and in some cases, even our children.
The day that they put her on the ventilator and everything, she said, "Mama, you're going to be mad at me." And I told her, "No, I love you. I won't be mad." She said, "Well, I'm tired." And I just feel like that was her telling me that she was not going to wake up.
He was a veteran. He was in the United States Navy. If Ralph could see this flag at the Capitol, he would just be so proud, you know, even though it meant something different, he would still be very proud.
I try to share about him as much as I can because I don't want us to become numb to, you know, the fact that these are real lives, these are real stories.
Our best days, they're coming. They're coming. And it's going to be incumbent on us to make sure that they are the very best days they can be. Maybe every March 6th, moving forward, we'll remember what we've been through and what it took collectively to defeat it. We're going to get through this. We're going to get through it together. We're going to come out on the other side. And I'm more optimistic than ever that we are going to defeat this virus this year, and we have a bright future in front of us.